Okay, we'll start the second session, controversy in hypertension, and congratulations to the organized committee, Dr. Muhammad Al-Ghani. I will call the first speaker, Professor Dr. Bader Almustafa from Saudi Arabia. Hypertension during exercise should be treated.
بسم الله الرحمن الرحيم. بسم الله الرحمن الرحيم. السلام عليكم ورحمة الله وبركاته جميعا. Ladies and gentlemen, good morning. Thanks for the organizing committee, Dr. Muhammad Abdul Ghani, and our chair, Dr. Abdul Mun'im, Dr. Mohsen Ibrahim, وكذلك أيضا for all the Egyptian Hypertension Society and for you as well. I've been given to address a title which having some of little data about exercise-induced high blood pressure, whether to treat or not. But before of that, let's ask, what is that? What is severe or high blood pressure? We all know that blood pressure is increasing during exercise. But how to define extremely increased? This is one. The other issue to address, how far is it prevalent is this problem? And if it is so, does it have any clinical implications? And how to detect it, if so? And if it is having some clinical implications, will it be treatable? And once treated, will it really decrease or reduce the cardiovascular or the non-cardiovascular morbidity or mortality? Let's try quickly in the coming 15 minutes to address this issue briefly. I'll try my best not to incorporate you in jungle of data rather than to go to any meta-analysis or systemic reviews that has been done to address this issue. This issue has been addressed in the publications more likely during the last 2 or 3 decades. So we are having some data about it. However, most of the data are limited to smaller groups. There is no good consensus about it, and neither we do have any guidelines to address it. So it would be a good really to discuss it, to raise the point about it, so to have it in mind, so it may increase our appetite towards it in the future. Some of the authors, rather, they would tell that any blood pressure more than 200 or 220 during exercise would be labeled as unusual, which might be suitable to be defining to an extent what is severe high blood pressure exercise. Other authors mentioned some figures based on their local data or local experience, that in some of their studies, they have shown that the 90th centile plus, which is the highest 10th centile of their individuals, might represent as extraordinary or severe hypertension. However, this is just an arbitrary definition, not really based on a cardiovascular risk, really. How common is that? Few of the DSs have mentioned in their studies about almost 1 to 10% of their individuals are having this severe high blood pressure during exercise. Let's take an example of that. This study have studied almost 800 athletes individuals. These athletes individuals composed of both males and females, and their age almost from 10 to 20 years of old. They are normotensive. They are having no chronic disease, young individuals. They have seen that the systolic pressure, mainly the systolic, have increased significantly with exercise, but it is not the diastolic. So what we are seeing here, that it is the systolic rather than the diastolic which is increasing. And if we compare the males versus females, we do see that the males keep to have their blood pressure rising among their age groups from 10 years as far they are aging. However, the ladies, the girls are having their blood pressure increasing while they are progressing in their age from 10 to 15. But afterwards, their systolic blood pressure is not that increasing. This variation might be in part related to hormonal issues, that we know that the hormonal development of girls started about 5 years earlier in comparison to their male peers. One more issue, in the upper graph, we can see that those who are having irregular, less frequent training compared with those who are having more regular training per week, they found that, as you can see here, in both males and females, as we are having more exercise per week, the least variation in their blood pressure. But the less exercise per week are associated with more variation in their systolic blood pressure. This may be attributed to a more sympathetic activity on those who are having less exercise in comparison with those who are having more exercise. They get used to the exercise, and by which their sympathetic reaction and reflex is less. This is one study which tried to understand the pathophysiology of increasing blood pressure during exercise. Many other studies have tried really to explain it. Some have really noticed that the nitric oxide concentration is different, and as by thus we are telling that this is an arterial or vasodilatory effect. The others increasing norepinephrine, reflecting a sympathetic activity, or changes in the RAS system, which reflects both a sympathetic or as well a RAS reaction. If we compare now the normotensive, I mean, those who are exercising, but they are normotensive, versus those who are exercising, but they are borderline or stage 1 high blood pressure, how they do react to exercise. Are they behaving similarly? Let's see. In the normotensive, more likely it is systolic blood pressure that it is changing, whether with exercise or with age or isolated. But diastolic, as we have just mentioned in the prior slides, is almost constant, or the changes is very small. And it is associated usually with increased cardiac output and vasodilation. But on those who are having high blood pressure, once they are exercising, their systolic blood pressure is reacting more aggressively. And this is more evident in those who are having or practicing dynamic exercise rather than isometric exercise. And in both groups, whether they are having dynamic or isometric exercise, hypertensive patients having as well increase in their diastolic blood pressure. This reflects that it is not only the systolic that it is reacting aggressively, but as well the diastolic blood pressure, while this is not the case in the normotensive exercising individuals. And it is more evident in these cases that we are having more norepinephrine and more renin activity. This is something which we have to put in mind, that these patients are labeled once they are exercising, especially if they are infrequent exercisers, to more sympathetic activity, which may put them in danger or having extreme reaction at the beginning of their exercise. So this is, we may advise from that issue, graded exercise is a must to be started in hypertensive patients. How far those who are having severe high blood pressure at 90th centile or having 210 plus blood pressure are having in terms of prognosis? Do they really having increased cardiovascular risk after 10 years, for example? Here in such a study, they have studied only a very small group, 150 individuals. And they compared those who are having severe exercise-induced hypertension versus those who are presented with no severe hypertension during exercise. And they followed them for 10 years. What they have found that the all-cause mortality is almost double, 8 versus 4 after 10 years. The major cardiovascular events, whether mortality or morbidity, is almost as well double, 10 versus 5. However, a new hypertensive is significantly, it is not only doubled, almost quartiles, almost 4 times, almost 4 times. And after they have done some multivariate analysis to exclude other co-founders like age, gender, other cardiovascular risk issues, it has been shown that exercise-induced hypertension is not an independent predictor of all-cause mortality, not significant predictor of any single major cardiovascular event, but it is an independent marker and a predictor of the total cardiovascular event. And it is as well a very strong predictor of a new future high blood pressure. Almost, as you can see down there, almost 3 times their peers, normotensive or non-severe exercise-induced high blood pressure. So from this, we can tell that severe exercise-induced high blood pressure is associated with increased cardiovascular risk event, total cardiovascular event, and as well the chance to develop a future high blood pressure. I'm having here a very good systematic reviews in the coming 2 slides. One of them is here showing it comprised almost 12 longitudinal studies. They are apparently having no target organ damage, and they followed up almost about 20 years, okay, in their average, about 15 to 20 years, to tell whether there is a total cardiovascular event or not among these patients. As you can see here from the graph on the right, there is a difference between 2 groups. Whether I have been behaving and showing severe exercise hypertension while I'm doing only moderate exercise versus an individual who had presented with severe exercise-induced hypertension while they are maximal exercise. I'm doing moderate or I'm doing maximal. What they have shown that those who have shown severe hypertension or severe high blood pressure reaction during the moderate exercise are having very strong prediction of having future morbidity and mortality. So it is the issue, not the maximal inducing exercise, high blood pressure. It is the moderate intensity that it is inducing high blood pressure, very high blood pressure, which is a predictor for increased cardiovascular events. Coming now to the how to treat it. So we know up to now that it might be common. There is some definition of it, at least the 90th centile plus. Some trial, to do that. And there is a prognosis, but how to treat it. And shall we screen for it? And if we are going to treat, what medications? However, unfortunately, there is no guidelines, no consensus about that. But some of the authors try to inform that, oh yeah, we might use it if we find it as in any issues like in sport medicine screening or so forth, we have not to neglect it as far as it is associated with future risk. The other issues, we may go for these patients or these individuals to have better blood pressure measurement and as well, not only blood pressure, but as well other cardiovascular risk assessment. And to have a planned follow-up for them. Not to ignore them. We have to label them. And my last slide to conclude, though we do have no guidelines and no good consensus, we have really to play a role. A definition of that to put in mind is the 90th centiles or having blood pressure more than 210, specifically when we are doing moderate intensity exercise. And we put in mind that 60% of these patients within 5 years, they may develop essential hypertension, persistent hypertension. And we need not to forget we having some other issues, which is called exercise-induced hypotension, which we need to put an eye on maybe in the future. Thanks a lot.
Thank you very much, Dr. Bader, for this excellent presentation. And I have a question. Can you use exercise-induced hypertension to segregate or to know the patient who are susceptible for developing a permanent hypertension?
Oh, yes. On these studies that have been done on young athletes or young individuals, they have shown that those who are having below 50s centiles are different in their future development of high blood pressure, of persistent high blood pressure in comparison with those who are 50th plus centile. And this increased a lot after the 90th centile.
I think Withborn published a paper in February 2023, and she stated that a spike, increased spike, early spike elevation of the blood pressure is one of the predictor. If the blood pressure do not elevate during exercise is another predictor. If the systolic and diastolic blood pressure elevated is another predictor. If the blood pressure, systolic especially, exceeds 250 is a predictor. Therefore, we try to use in exercise-induced hypertension to know the pre-hypertensive patient who will develop actual hypertension. Am I right?
Totally agree.
Thank you very much, Dr. Bader, for this very nice presentation. However, when we talk about this, you presented a study concerning the young adults. So if we have people like, the guys who are coming, they are evaluated for doing an exercise. Do you put an exercise test as one of the tests before sharing the exercise to know the response of their blood pressure?
If they are doing competitive exercise, almost this is a must. But if they are doing a recreational exercise, it might be following just the guidelines of how to have a graded exercise will be, I would say, a sufficient issue. But for competitive ones, we need to have the patient, the individuals tested.
Only for the sake of time, we thank you very much, Dr. Bader.
شكرا جزيلا.